Hi, how can I help you today? Okay. Last name? The I or O? Okay. First name? And date of birth? Alright. Okay. Well, so your doctor prescribed you to things that your HSA covers. That's awesome. Okay. Alright, so first one is this. You've seen one before? Yeah. Okay. Now, this is just a sample. This is not the one we're going to give you. The one we're going to give you is a little bit different. But your doctor said you just had surgery, so she needs to do this and come to 1,500. That's her goal. Now, she might not be able to for a few weeks, but she said, okay, so I know it's going to be hard. You're probably going to have to be on her, but you have to do this 10 times an hour. Yes, because she was under. There's a risk of catching pneumonia if you don't inhale and get your lungs going. Yeah, a lot of people don't know that, but whenever you have surgery and you are put under, you have that risk. So this is very important. Now, I know that 10 times an hour seems excessive. She needs a rest. She just had surgery. So you do not want to wake her up to do this, okay? So just whenever she's awake, I know the doctor says 10 times an hour. But doctors are very by the book, okay? Us pharmacies know really more hands-on. So I would say just 3 times every hour that she's awake, because she's gonna be out of it for the first 2 days in a lot of pain. So just start slow, like today, later on, before you give her medicine, just say, hey hon, do this, okay? So it does pull out. Comes off. You could wash it. It's very good to wash it. Easy to put back on. But like in case like she's laying down and it does stretch. So there's some that you breathe out. This is, you want her to breathe in. She wants to get air in. Okay, there's a indicator right here where it should be when she's breathing in. It should be in between these lines, okay? So it kind of looks like this. You'll be able to see this and how far it goes up, okay? You want to take a deep breath in, breathe out, and then suck it, okay? Now, she might be in pain, so it might hurt when she inhales like that, because you do have to hold it. That's okay, that's normal. Should go away after 4 weeks, I would say, because everybody heals different, and if it's still pain, then you need to call her doctor, okay? So I'll try it again from the side so you can see. Yeah. So I said, the one that your insurance covers that is free is a little bit different. This has a ball, same thing, you inhale in. There is an X. You don't want to, she doesn't want to suck in all the way to here. You just want to suck it into where there is a check mark. And this one doesn't really have 14. It has 13 to 2,000 milliliters. Oh wait, it does. It does have 15. So I don't know where I got 13 from. So it's you could hold it. She could hold it. It's the same thing. So I'll put my germs on it. Same thing. It does. So she don't have to be so close to it. It does come off, so you could wash it, get rid of the germs. Make sure when you wash it that you don't put it on right away. You want to leave it out so that it dries on the inside, because you don't want her sucking in moisture or water, because she's already going to have that in her lungs from the surgery. Okay, do you have any questions? Any questions about this? No? Okay. Next, let's see. So she does have high blood pressure, and I'm assuming you don't have a blood pressure machine at home. It broke? Okay. That was good thinking, because most people don't know that you can get a prescription for a blood pressure machine if you suffer from high blood pressure. That way your insurance will cover it. And if it doesn't cover it, you could use your HSA. And if it only covers a portion, you still can use that. Okay. So this is your basic. It's very compact. It's your basic machine. It does have memory. So for instance, you press start, but it's not going to start. It just turns it on. And then you press start. And then it will do it. And this is going to give an error because we don't have nobody in there, right? So let's just let it. Okay, so E1 means error. So let's say it did take the blood pressure, you would just put memory. There is 2 users, so you could use it and keep yours as a memory so you know. And then you go to user 1 would be her, user 2 would be you. So let's, and you stop. Okay, so let's see. Right now, it is saying user 2, so I'm going to press users, and now it says user 1. Yes. And so that way both you could use it, and you always want to press memory because you might forget what it was, and that way you could track it for your doctor to make sure that her blood pressure is under control, that it's getting better. Because if she's on certain medications, like maybe he put on pain meds or muscle relaxers for her surgery, those can make your blood pressure drop really low, so you want to keep an eye on that. Other medication can make it go higher because she's in a lot of pain. Automatically her blood pressure is going to go higher, so just keep a track on it. If her bottom number gets above 100, I would say call your doctor or call nurse. Let's see what insurance you have. Okay, good. You have the good insurance. So this insurance, if you look on the back of your card, it actually has a nurse hotline. So you can call the nurse and tell her, look, this is her blood pressure. Like if it's 160 over 100, I would call to see what they advise. They could walk you through it to see if it's the medication or something she ate or anything like that. So it's very good to have. Okay, so let me go ahead. Let's see. Alright, so your insurance did approve both of them, so there is 0 copay. That's awesome, less stress for you. Let me just go ahead and get a bag. Okay, you have a nice day. If you have any questions, just go ahead and give us a call. Alright, bye-bye.